Good morning. My name is Eric HIMSS. I'm the CEO at Keystone Technologies. Today we'll be highlighting how Keystone's collaboration with AWS is helping us to deliver healthcare data to our clients. At our core, we're a healthcare company that believes that technology provides the largest opportunity to improve patient care. In short, we deliver critical healthcare data to medical practices when they need it, how they need it, in order to provide the highest possible care to their patients. We're an AWS consulting partner, advanced tier. We have a 21-year history of referenceable and successful healthcare engagements. We serve acute care as well as the ambulatory space, having worked with many large health systems and medical groups around the country. But before we get deeper into how Keystone leverages AWS cloud technology, I'd like to tell you a personal story. Meet Becky. This is my mom. She was diagnosed with lupus 31 years ago. When I was a teenager, she'd take me out of school on the days that she had doctor's appointments, so I could help her lug her medical records out of the trunk of our car and onto a small foldable cart. It was heavy, overstuffed with accordion files that were filled with test results, copies of doctor's notes, faxes, research articles, medical bills, and on and on. Years worth of paper that related to her diagnosis and treatment from dozens of doctors. During one such visit, Mom and I were sitting in a patient room at Barnes Hospital in St. Louis, Missouri, waiting for the doctor to come in, and feeling a little exasperated, I asked her why she needed to bring all this paperwork to every single appointment. She looked at me and with a very serious tone said, "There are so many doctors involved in my care that I cannot afford for any single doctor to not have all of my information." This hit me like a brick. I could not imagine why a hospital computer system couldn't handle this seemingly simple task. A decade later, I started my first job in healthcare IT, and I learned the reason why. It's a problem that we're closer to solving, yet when I attended HIMSS in 2019, the looming question of the conference was, will we ever solve the interoperability problem? Today, thanks to EMR software technologies like Fire and Amazon HealthLake, and integrators like ClearData and Keystone, my mom no longer brings her paper medical records with her. We've come a very long way in 30 years, but we still have work to do. This is the question that spurred me into action when I founded Keystone 20 years ago, and what still inspires us today. We turn that inspiration into action in the following ways. Number one, healthcare IT thought leadership. Technical, operational, and financial strategies. We're just as comfortable in the hospital boardroom as we are in the data center. Number two, ambulatory EMR hosting. We're experts in HIPAA-compliant cloud hosting of ambulatory EMRs. Utilizing various AWS technologies, we securely host, manage, and maintain these environments for all specialties. More on this in just a few minutes. Number three, we're also one of the nation's leading experts in EMR data conversion. We handle all aspects of the conversion process, from the legacy system extract to the transform to the load into the new production EMR. I'm proud to say that our Bridges certified team of data architects has executed two of the largest Epic data conversions in Epic's history. The biggest impact we make and how we best accomplish our mission is through our ambulatory EMR hosting. Our AWS-based solution consists of the following elements: an acute focus on the clinical workflow of the practice. This affects how we architect the overall hosting solution. Real-time management and optimization of your EMR. High performance, high availability through AWS. ongoing real-time data security and compliance, dedicated client care team to handle service requests, full server access available for your internal IT team, and providers receive immediate access to PHI so the patient-physician dynamic is not disturbed. We host over 30 different ambulatory EMRs in AWS for a variety of specialties across the country. We understand the unique needs and workflows of each specialty and client. Typically, the more complex and sophisticated a practice is, the more we are valued. We know how a medical practice should function when technology is no longer an interruption, but is supporting a smooth and efficient clinical workflow. Let me demonstrate one case study on how AWS enables our clients' success. Orthopaedic Institute of Western Kentucky had an aging on-premise infrastructure of an otherwise successfully implemented NextGen EMR. This infrastructure was becoming increasingly unreliable and more expensive to maintain. Utilizing EC2, S3, RDS, and Direct Connect technologies from AWS, we enhanced their overall patient care experience by vastly improving performance, reliability, and security, while getting their technology spend back under control. Once we migrated Orthopaedic Institute's NextGen EMR to AWS, they experienced a 30 to 50% general increase in speed of application responsiveness, field to field and screen to screen. A huge performance improvement in moving between modules of the NextGen application compared to the past, and printing large rev cycle reports used to take hours. This was reduced to minutes. I'll provide one additional anecdote. While recently working with Orthopaedic Institute's new rev cycle partner, they noticed that there was a large difference in speed and performance between what they saw at other customer sites and what they observed in the new AWS environment. We were able to place the SQL temp file on a new, much higher tier flash storage overnight and reconfigure SQL to achieve a reduction from around 45 minutes to process a large rev cycle batch down to 7 minutes. The impact of EMR hosting on AWS yields greater flexibility and scalability than on-premise environments, enhanced management and security, which translates to improved business continuity and less downtime, the ability to control IT costs throughout the technology stack, and most importantly, utilizing AWS, providers experience immediate access to patient data whenever and wherever and on whatever device they are most comfortable using. We view success in all engagements through the lens of the patient. If our work doesn't serve to improve patient care, then we have failed. With AWS, risk of failure is almost completely mitigated. AWS gives us the technology building blocks to allow us to architect fully redundant EMR cloud solutions, which could previously only be afforded by large IDNs. Keystone's mission is to ensure that healthcare providers have the information they need in order to provide the highest quality of care to their patients. Everything we do is driven by that. No other element of our solution is as central to this mission as AWS. If you have any questions about our services or would like to discuss our ambulatory EMR hosting or data conversion services, please reach out to us. We'd welcome your questions. Thank you very much.